Hey everyone. Hey sis. Hey love. What's up? Is this face lay, girl? Thanks, girl. Let me accept this. I'm trying to tell them. Thanks, girl. You taught me everything I know, girl. Hey, sis.
You look bomb.
Thank you. No, your hair is bomb.
Thank you. Thank you. How are you doing?
I'm good. I had a few technical difficulties logging in. That's why I'm a few minutes late, but period, I'm here. We made it.
Exactly. That's all that matters.
How are you?
I'm good. I'm happy it's Friday.
Yes. I'm so happy it's Friday. I'm loving this background.
Thanks. I'm in my room, in my bed today. I decided
Okay.
I'm here today.
Yes. It looks like it's about to rain.
Yeah.
Mm-mm.
Yeah.
Okay. So I guess I'll give it a few minutes so we can get a few people to hop on. Hey everyone. Hey
Hello.
Orlando.
Yes. Good vibes.
Yes, we do live for the hair, baby. Yes, we definitely do.
I love
Okay.
twang in your voice. Where are you from?
Oh, I'm from Memphis.
Yes, love it.
From Memphis. Let me bring it down. Okay. So we're gonna get into some things today. And this is our first time like being on live together. So yes, I do live for that because I feel like we're always showing support for one another when we see each other online. So it's just like, oh my God, we're finally on together.
Uh, can't wait to do more. Today's gonna be a good time.
Yes. Okay, so I guess we can. I feel like I'm gonna wait till we get to 7 because that's like my number. We keep like bouncing from. Okay, right back. Yes. Okay, so I guess we'll just dive on in now. So everyone, I'm Marshun. I work here at Whitman-Walker as a community outreach specialist. My pronouns are he and she. And I'm the live OG for those of you who know me. And I'm joined today by Soul, and I'll allow her to introduce herself.
Hi everybody. I'm Soul. I'm one of the media influencers in community health and one of the art educators at Corner. My pronouns are she, they.
Yes. Okay. So, everyone, as you know, during the past few months, Woodman Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI sexual health practices, access to care, social determinants of health, and public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to help and support and educate you.
Exactly. So today we're going to be talking about COVID and its effects on mental health. So let's get into the fact that these numbers in the US are steady rising. Folks is still, COVID is still here.
Baby, still here.
Take care of yourselves. And as we know, with any new virus that spreads, there's fear and anxiety. And COVID 19 being extremely alarming based on how fast the virus is spread and the massive amount of people who have been infected by the virus, especially right here in the US, the global epicenter of the virus.
Right. According to the CDC, COVID 19 has a great effect on mental health that falls into these categories. Stressors during a time of pandemic can occur based on one, the fear of you or a loved one's health, two, changes in sleep pattern and diet, three, an increased use of substances, whether that's alcohol, cigarettes, or other drugs. 4, worsening of chronic health, and 5, worsening of mental health.
Yeah. And everybody reacts to stress differently. So just because one may be responding differently to the pandemic shouldn't discourage you, but encourage you to cope with your stressor in your own healthy way. There are many different ways to cope with stress. Do you mind telling us a couple?
Yes, of course. First, let's start taking small breaks here and there, following up on stories concerning the virus or any other negative news, just because your brain needs time to not process that. Like it needs to relax.
Yes. Also, taking care of your body in addition to your physical should be on point at ease at well. So that means, taking walks, since we're all in the house a lot, just getting some physical activity going. Having extreme anxiety along with other stressors can result in poor wear on. So participate in your own holistic care. You can meditate for one.
Yeah,
There
meditating is great.
are videos on YouTube that you can watch to help you meditate. There's a lot of apps that you can download on your phone that coach you how to meditate and when to meditate throughout your day, and they will remind you. So look into them as well.
Right. Another one is eating healthier. I know like we have nothing but time now, so we're all on the internet, surfing, looking at different things and seeing like different recipes because everyone's cooking now. Um, and food has actually played an important role with coping during COVID. And I know for me, like I have my sweet tooth where I just crave like a frozen Snicker bar. Like I'm literally obsessed with them for some reason.
Yeah,
Um, and I know that's not healthy, but I just kind of had those like on my cheat days. But because of COVID, I've actually like really, really started cooking more, and I've started looking at different recipes they have online. Just because I don't want to start eating really bad now that I'm in the house so much, especially since I work from home now. So it's just like I never leave the house. Um,
what's
so
your thing to cook? What's your favorite meal that's come out of quarantine?
My favorite meal that's come out of quarantine is my best friend taught me how to do like cream of mushroom, no cream of chicken, and like bake it either with like pork chops or chicken breast, and it's such a mood to me. Like my mom used to make that, and I know that's not the healthiest because that cream of chicken has like so many calories, but it's so good. Like oh my god, it just reminds me of home and it's
Yeah,
you can eat off of that for like 2 days compared to going out spending money and eating
right.
off of that for just like 20 minutes. So it's definitely my fave.
Yes. I've been stepping my taco game and just like
Yes,
make different type of tacos.
yes. I love tacos. Literally, I made tacos Tuesday. Like every Tuesday, I literally have to make tacos.
Me too.
It's definitely a move. Um,
Another way
okay.
to cope with stress can be exercising, like I said, taking a walk. Um, One of our social media influencers, Orlando, he teaches salsa classes and he started to do them on Zoom. So like, that's another way to get your body moving, like doing some Zumba or like doing watching YouTube videos that have like movement in them that you can follow along. That's a good way to exercise. Are you exercising at all?
Yes. First of all, tacos are definitely about always. Period. Yes, especially with a shot of tequila. But yes, I actually attended Orlando's Zoom yesterday during work. I was like, okay, I needed just like this break because work can become stressful, most definitely, and just like those mental breaks you kind of need throughout your day. But what I actually do, I actually go running. So I probably go running maybe like 2 or 3 times after the week. I go running maybe like 2 miles. I sprint like 1 mile, and then I go like jog another mile. I just I love running.
That's good.
Yeah. Another great thing to remember is sleeping, you guys. Please get an adequate amount of 7+ hours of sleep. Sleep is important just because your body needs time to relax. According to medical news today, sleep is extremely vital because it gives the body a chance to repair and be ready for the next day. So if you're not sleeping, how can you prepare yourself for the next day? Your body needs time to rest.
Right, to reach out.
Please.
You can also avoid substance use. Um, that's a good way to take care of yourself and your
Yes.
body.
Make time to yourself to get some peace of mind at least once a day, like I said.
And connecting with your loved ones virtually, or even if you're like outside and socially, physical distancing, that can still connect with your loved ones, checking in on them, to them. Everybody's just as worried, so expressing yourself can lead to a calm state of mind.
Yes. Sleep rebuilds cells most definitely. Like, I don't. I try to at least get eight 8 hours of sleep. If I can get nine, I'm just like, oh my god, yes, today's gonna be a great day. Um. So now we'll segue into quarantine effects on mental health. For those with mental health issues and those without, being stuck in the house and with the curfew in order does not help improve one's mental state of mind in times like this.
Yeah, according to the Washington Post, and with an estimate of all three jurisdictions within the Mayor Muriel Bowser stated that it is possible 1 in every 7 people within the district might contract the virus. That being said, currently, although the stay-at-home order has lifted for the DMV, we should all still stay at home as much as possible. Also, the mayor of DC just mandated that all people must wear masks when they're leaving their homes, with the exception of kids under the age of 3, those doing vigorous exercising away from everyone, those who are actively eating, and those who are alone in an enclosed office space. So that means everywhere. Like if you go outside, make sure
Literally.
you're going to the grocery store or like you're just taking a walk. Like if you're just taking a walk, make sure you have your mask on because it won't really affect your breathing too much. If you're doing vigorous exercise, try to do it, away from people so that you can not keep your mask on. But as soon as you're done, put that mask back on. You're protecting yourself and you're protecting other people. It's really important to wear your mask, guys.
Yes, the moment you open your door and you turn that lock to lock your door, your mask is just automatically supposed to be on. And I know it's kind of weird adjusting to that because I've had moments where I like get to my elevator to leave my apartment. I'm just like, oh my God, I don't have my mask. So I have to turn all the way back around just because it's becoming the norm now. And it's just not something I was used to. But the purpose of all of this and the purpose of quarantining is to prevent the spread of any more germs, especially COVID-19, and preserve any germs or sicknesses you or anyone you live with has already had or contracts.
Yes, by being isolated, especially one that feels even more hopeless or helpless from everything going on, which creates a feeling of uncertainty and causes even more worry.
Right. Like, I'm just gonna ask you a quick little question, if you don't mind. What effects do you think COVID-19 has had on your mental health, if any?
I definitely think that it's made me more irritable,
Mm-hmm.
just 'cause, like even just being in my house with my mom have an amazing relationship, but like we're used to like going outside to work and then coming back in.
Right.
Both of us telework, both of us working from home. Sometimes we just get on each other's nerves. And so
Yeah.
there's I had a little bit of insomnia from time to time. Um, yeah. What about you?
I can definitely agree with needing that space outside of my household, just because I am working from home as well, and I'm in here by myself the entire day. But I mean, I like being by myself too. But I mean, you still want that time to leave your space, and that's why like I said earlier, that's why I go running. I try to exercise just because it gives me like that space outside of my living room or my bedroom or my kitchen, just because it can just become so annoying at times. And I mean, yeah, you can call your friends and stuff, but you still want to leave your house. It's just, I don't know. It's
Yeah,
just, you just don't want to be in the house.
yeah.
I've never been a type to just want to be in the house. I always want to like be doing something. Um, but yeah, I definitely feel you on that.
What are different ways that you've been coping with that outside of, well, you said you've been exercising,
Mm-hmm.
making plans to a little
And,
bit.
and sleeping, and
Yeah,
I've like I don't know, like I've been working on some mini little projects just to kind of like get my mind out of being in the house. So yeah, so we have some things coming. Hopefully, we'll see. We'll see. What
yeah.
about you?
Um, Going back to work at the corner was helpful.
Hmm.
um, I have been doing morning pages lately, just like writing down my stream of conscious. That's been really helpful just to get everything out of my brain. I think a lot. uh,
Yes.
yeah,
Like she said, leaving the house hits different. Now, when I tell you, it hits so different. Like when you snuck out the house growing up while your parents was asleep, like it hits different like that. Like oh, anyways.
some possible mental health effects of quarantine have been fear, sadness, insomnia, numbness, and post-traumatic stress disorder, anger and irritability, a low stress, emotional disturbance, and depressive symptoms.
Okay, and so now we'll discuss some different ways to cope with COVID-19 pandemic and quarantining. According to verywellmind.com, a website for health information and tips provided by health professionals, here are a few things that can help one with coping during COVID-19 and quarantining. One example is establish a routine for your day to give yourself something to look forward to. So, me personally, I look forward to taking shots to my friends every day. It's kind of become like a self care thing. Especially after like once I go running, I can come home and take a quick little shot with my friends. That kind of like gives me something to look forward to. Since I mean, yeah, I am still in the house, but it's still not like I'm just sitting here all day, just bored watching TV, just because that can become so exhausting sometimes. And like you said, you can get in your head, get to thinking about different things. So that's what I look forward to doing. But actually, what's something that you look forward to doing every day?
I like to have wine dates with my friends, so
Yes.
similar to you with the just like getting on Zoom and like
Mm-hmm.
and dates or like earlier this week I watched a video, like an hour long video with my cousin. So, like that was cool. Just all of us on Zoom, like talking about the same thing, watching. Still like a good experience. We couldn't all be together.
Right, because it kind of like gives you that look forward to like when we could go to parties. You've been on the phone with your friend planning what you're gonna wear, what time you're gonna be there. All
Right.
of, it's kind of like that good look forward to. So I definitely I definitely agree, and I feel like everyone should maybe like think about something that they look forward to, just because it's like that extra boost. Like just like on Fridays, which is like extra motivated to leave and go home, you
Right.
need to find something that kind of gives you like the extra boost throughout your day, just because we are physically distancing ourselves, and it's really hard for some people.
Yeah.
um yeah.
We we can also be active as possible. Stay
Hmm.
no physical exercise can lead to a number of breakdowns on the body. Um, no, not everyone can be as physical as they want, but sitting outside for a breath of fresh air can also.
Right, and combat frustration and boredom in addition to exercising. Take this time to pick up a new hobby, whether it's drawing, painting, instruments, a sport, or whether you feel it's best for you. And be sure to catch up on some rest. It is extremely important during this time just to listen to your body.
And keep yourself informed about what's going on, but do not overwhelm information.
Right. Most importantly, remind yourself that you have an ultimate purpose, and to keep you and your community and your body safe and healthy.
Exactly. So now let's share some resources. For local social services, the National Alliance on Mental Health has a helpline that offers free assistance and advice 24 hours a day, 7 days a week. You can call them at 1-800-950-6261, or you can visit their website, NAMORG, or you can text NAMI to 741-741.
Yes, thank you everyone for joining Soul and I today, and thank you so for that. I just want to remind everyone to stay at home, wash your hands, wear a mask, and be sure to follow us on Facebook, Instagram, and at Real Talk DC _ for the most up to date information about Whitman-Walker services and more of these social media outreach sessions. Call the number we have below. Well, actually, we don't have one below. Well, what is that number, Soul? Hmm.
Let's see. I think that number is.
What is that number? I don't have. Do you have it?
I'm.
Well,
I'm
if you have any questions, just feel free to DM us on Instagram.
yes.
And also, I want to remind everyone to take the time to take care of yourself, just because it's gloomy outside, and I know we can get in our emotions and in our feelings sometimes. So I feel like it's necessary that all of us have some self-care, whether that's, taking a bath, watching a show. Just make sure you have some time to yourself.
Yes. And shout out to Paul, who is commenting at Whitman-Walker, and he put the number. The number is 202-797-4439.
Okie dokie. Well, I hope everyone has a great weekend. Thanks for joining me, Soul, and I will TTYL.
Everybody.
Bye.